I like to be the best at things. That's why we get into this field. It's a long road. What you want to do is your best to help others, and that's ultimately what's rewarding. I actually entered college thinking I was going to be a mechanical engineer. Started off down that route, and I realized a lot of the classes and skills I was learning overlapped with some of my friends who were in the pre-med. I actually converted halfway through college to majoring in neurobiology. A lot of the things we learned in the neurobiology field had to do with the way that the retina was connected to our brains. When I entered medical school after that, I already had a really good foundation in ophthalmology, specifically in retina, and that interest just kept growing. As I learned about other parts of the eye, you realize that the cornea can be replaced. You can have a transplant, cataracts can be taken out, and lenses can be put in. The retina cannot be replaced. Surgeries are amazing, and once I got a taste of that, I knew this is what I wanted to do. I got to perform my first pars plana vitrectomy, which is like the bread and butter case that we do in retina. You go in, you remove the vitreous that's inside of the eye, and when you sit down like at the scope, and you're looking through it, and you can visualize the retina and everything's in 3D, and you're in there with your instruments. That's a very special feeling to be able to take care of patients in that way, and I knew at that moment that this was a very challenging field, but one that would be very rewarding as well. You know, what they say, the eye is the window to the soul, is very true. There's a lot of things that we diagnose in the retina clinic that give you a clue about somebody's systemic condition. We can identify high blood pressure, diabetes, sometimes earlier on and before the primary care doctor can. Even more serious conditions like cancer can be seen even by looking through the eyes. That medical necessity of retina is really what drives me, motivates me to pursue this field. I think the most rewarding thing is when you have a very complicated surgical case and you had poured your blood, sweat, and tears into it, and you had a difficult time, but you did it your absolute best for the patient. That feels very rewarding. They're happy, you're happy, and that's kind of the best part, is that you've taken the skills that took more than a decade to accumulate, you put them to use, and then you see a positive result from it.